Whether you believe in God or not, the Serenity Prayer looks at two aspects of facing life's biggest challenges. The first is the serenity to change the things I can change and to accept the things I can't change, but with the caveat that I need to have the wisdom to know the difference between those two things. So I've been thinking a lot about that in the last day or two. I've thought about 3 different examples. We really need to take a look at what we can and can't change. I'm Steve Goldring from simplehormones.com. I help patients and healthcare practitioners with easy to understand patient education resources. Most of those are about hormones and hormone optimization. And this video is no exception to that because this is all about hormones. The question is, can we do anything to change our hormone situation or not? Well, Debbie was diagnosed with type 2 diabetes. She was put on multiple medications, and over time she eventually was put on insulin, and eventually she experienced some kidney failure, and she was having surgery to remove toes one by one because diabetic foot disease was causing a constriction in her blood vessels, and she was just having more and more problems. She was gaining weight rather than losing it. She was getting worse and worse and worse. Now, she had a very good attitude, and she listened closely to her doctors, and they told her basically that diabetes is a progressive disease, and eventually she would probably have to give in to the fact that diabetes, either directly or more likely indirectly through kidney disease and kidney failure, she was eventually put on dialysis. She might eventually have a heart attack or some kind of secondary problem that was really rooted in the fact that she had type 2 diabetes. Essentially, what Debbie had been told over and over and over again is that diabetes is something that was set in stone, something that she could not change. And she trusted her physicians and the healthcare practitioners all around her who told her that this was something that she just needed to accept. Kyle has parents in their 80s. And Kyle's mother has been diagnosed with Alzheimer's disease. She's in relatively early stages, but she's definitely declining. When Kyle talks to his mom on the phone, it's sometimes a little difficult because his mom doesn't remember much. Sometimes in the course of a 10-minute conversation, she'll ask the same questions several times. And Kyle's dad also has some memory issues. And Kyle's parents are definitely declining in their cognitive ability. Now, Kyle has had a genetic test which shows that Kyle has not 1, but 2 copies of a particular gene called APOE4. And what Kyle understands is that APOE4 is a genetic marker for Alzheimer's risk. He has about a 7 times higher risk of Alzheimer's than anyone else he knows. Men are more likely to experience early onset Alzheimer's. Kyle's in his early 60s, and so possibly by age 65, Kyle could start experiencing cognitive decline, and he's deeply concerned about that. Kyle is wondering if there's anything he can change. The third person I want to highlight is Susan. Susan is 58 years old. She has been experiencing symptoms of menopause for several years. She has hot flashes every 10 minutes, sometimes 50, 100 hot flashes in a day. She has brain fog where she can't remember where she parked. She can't remember which car she brought. She can't remember why she came to this place in the first place. She can't remember where her keys are. The main reason why she has that brain fog is because she hasn't slept in months. She gets 2 to 3 hours of sleep every single night. She's gained weight. She can't seem to lose weight. She's never gained weight before, but all of a sudden in her 50s, she has this terrible difficulty with losing weight. And no matter how much she exercises or how much she eats like a bird, she just can't lose any weight. She's irritable. She's angry. She's moody. She has no sex drive. She and her husband are not getting along at all. And here's the thing, she has talked to her primary care provider, and her primary care provider has just told her that's the way it goes. You're just going to have to get used to it. There's nothing you can do. So when we look at our dear poor friend Debbie and the diagnosis of type 2 diabetes that literally millions of Americans have experienced, the vast majority of those Americans who have that type 2 diabetes diagnosis have been told the same thing. There's really nothing you can do other than take a bunch of medications. Eventually, you'll end up on insulin. Eventually, you'll end up with some major complications from diabetes. It will probably get worse. Just kind of recognize that and accept the thing that you cannot change. So one of the things that Debbie has absolutely no control over is the cost of diabetes medications. Now, there are two things about diabetes medications that I'd like to point out. One is the costs can be astronomical, especially if a person doesn't have insurance to cover those costs. And even if they do, those costs are paid by someone somewhere on the line. Diabetes exerts a huge cost on our economy because so many people have it, and because the drug companies are charging so much for those diabetes medications. Now, the second thing about diabetes medications is the vast majority of those medications don't really stop the progression of the disease. They might slow it down a little bit in some cases, but they don't really reverse the diabetes. They just kind of cover up the symptoms in a lot of ways. Well, I've come to believe something completely different about type 2 diabetes, as well as something called insulin resistance, which is also often referred to as prediabetes. There is a general sense in the population, especially among people who have prediabetes or diabetes, that there's not a whole lot that we can do. But I would beg to differ. I believe that there is something we can do. In fact, there are a number of things that we can do to decrease insulin resistance, prevent or even reverse type 2 diabetes. And those have a lot to do with diet, with sleep, with exercise. There are a number of steps that you and I can both take. I'm taking them right now because my body has a tendency toward insulin resistance. And so what I'm trying to do is increase my insulin sensitivity by decreasing the amount of carbohydrates that I eat, by using intermittent fasting or what's called time-restricted eating. I'm also trying to get as good of sleep as I possibly can, and I'm exercising much more than I ever had in a long time. And there are several more things that you can do to improve your insulin sensitivity, which in the long run can help prevent and maybe even reverse type 2 diabetes. Now, I'm not a doctor and I'm not offering medical advice. All I'm saying is if you've been told that you have type 2 diabetes and there's nothing that can be done other than throwing a bunch of medications and eventually insulin and other things at your diabetes, you may want to seek a second opinion. You may want to take a closer look at what you can do rather than just accepting this as something that you cannot change. Now let's look at the second example. My friend Kyle, who is homozygous, which means he has 2 copies of the APOE4 gene. That gene codes for a higher Alzheimer's risk. The one thing we can't change is our genetics. Kyle's genetics are determined by his parents. He gets 1 copy of his genes from his mom and 1 copy from his dad. And once that's done, it's set in stone. You will never be able to change your genes specifically. Well, my friend Kyle may not realize that having those genes doesn't necessarily mean you absolutely will get Alzheimer's. There are several factors, including insulin resistance that I've already talked about, that can have an impact on what's called epigenetics. Epigenetics are the other factors that determine how those genes play out. And so there are many lifestyle changes, including exercise, improving your insulin sensitivity, improving the whole body inflammation that can increase your likelihood of Alzheimer's, improving your gut health, reducing the impact of concussions and other brain trauma, brain training like crossword puzzles, reducing alcohol. Your genes are not your destiny. There are some things that you can do to make a difference in your cognitive ability over the long term. Now, if we look at our third example, that is the woman in menopause, Susan. That woman has been told so many times by her primary care provider that there's really nothing she can do. Susan can seek a second opinion from another provider, perhaps one who's more familiar with hormone optimization, and that provider might tell her, wait a minute, there are some things that we can do to optimize, first of all, your estradiol level and your progesterone level. If we optimize your estradiol, that will either reduce or possibly even eliminate hot flashes and night sweats. It might help settle down irritability and mood swings. It might help you to be able to lose weight more effectively when you implement diet and exercise changes. If we give you optimal levels of progesterone, you're most likely going to be able to sleep much better than you had before. You're probably going to be struggling much less with anxiety and depression if your levels of progesterone are optimized. We'll take a look at your testosterone levels, which might improve your libido and maybe even your marriage relationship. There are a number of other hormones, including DHEA and cortisol and thyroid, that we might want to take a look at in menopause. And so there are things that you can change in menopause to make a real difference in the symptoms, but also in the long-term health risks that you're going to experience over the next 20, 30, 40 years, including the risk for Alzheimer's disease, which I've already talked about, and the risk for type 2 diabetes in Debbie's case. So in all three of these cases, these people have been told, there's nothing you can do. You just need to resign yourself. You just need to accept that you cannot do these things. Well, I'm here to tell you that there are some things that you can change. And if you continue to run up against doctors and practitioners who say that you can't change them, maybe you need to get a second opinion. And I have relationships with some providers that might be able to help you with that second opinion because they have a lot of training and expertise in helping patients with their hormones and getting patients to a level of optimal hormones, not too high, not too low, but just right so that patients have a relief from their symptoms, but also improvement in their long-term health risks. If you like this video, be sure to click the like and subscribe buttons and click the little bell to make sure you get notified anytime I post a new one. Thanks so much for watching, and I'll look forward to talking to you again soon.